So for the next concept we should be looking at is what is known as what? Intracerebral pressure. So we'd like to break down these words. Intral is inside, cerebral is cerebral, okay? Pressure is pressure, alright? So what this simply means is what? Is also known as what? Intracranial pressure. You know, it just happens to do with what? The pressure that is what? Inside the skull. That's where what? The brain is. You know, so it refers to the pressure inside your skull from the brain tissue, right? Cerebrospinal fluid and the blood. You know, of course, if there's increased pressure, there's a disbalance in any one of these. It could be that cerebrospinal fluid is too much. It could be that brain tissue is growing too much. That's a tumor. Do you understand? It could be that maybe the blood is too much or blood is bleeding. Yes, there's a bleeding into what? The brain. You know. So it's a tightly regulated system, right? So when pressure rises too much, it becomes life-threatening, right? So normally the intracranial pressure should be about 7 to 15 milligrams per mercury in adults. So anything more than 20 is elevated. Do you understand? And it shows that there's a disease condition. So causes of this increased intracranial pressure is what? Traumatic brain injuries, so stroke or brain hemorrhage, brain tumors or abscesses, hydrocephalus, alright, infections like meningitis, encephalitis, then idiopathic intracranial hypertension, alright. Idiopathic, that's when the cause is not known, alright. So symptoms to watch out for: if the patient is having persistent headache, it shows you that there's what? Increased pressure. You know, there's nausea and vomiting. If they're not seeing very well, there's confusion or altered consciousness, there's seizures. Alright, infants, because the skull is not that hard, it can now bulge, you know, and all of that. So diagnosis is, you want to actually look into the brain and see what is wrong. So CT scans, MRI, lumbar puncture to measure, right, and all of that. So treatment options: medications like what? Mannitol. Those are all those what? Diuretics to reduce the fluid. So hypertonic saline, barbiturate, CSF drainage via the shunt and catheter, surgeries like decompressive cranial and craniectomy, right, in severe cases. Then also treat the underlying causes and all of that. Okay, so that's it.